Hello, and welcome to another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Kidney Cancer Foundation. I am also grateful for the support that we get from Exelixis, Merck, and Ipsen, and I am so excited for this episode today. I'm always excited for episodes with our lovely guests, but this one is really special and personal to me because I have with me a fellow patient advocate and kidney cancer extraordinaire, Katie Coleman. Katie, welcome to the podcast.
Thank you so much for having me. I'm super excited I think this might be our first podcast together.
I think it
I'm
is.
super excited about it.
I think it
Yeah.
is. So yeah, first time for everything, I guess. But so yeah, I've known you, Katie, since almost the beginning of your kidney cancer experience. And I know that you were previously on the kidney cancer conversations that Judy Nicholson Foundation previously had, but maybe for our listeners who are not familiar with their story, which I feel like can't be that many people because I feel like everybody knows Katie at this point, but maybe you don't mind sharing a little bit about your story and how you got here.
Yeah. I'll share the Cliff Notes version here, because our story crosses paths in several places as well too. But so I was diagnosed in December of 2020 in the ER. I was 29 years old at the time and had about a 12-centimeter tumor on my right kidney, and then what would end up being about 15 or more tumors in my liver. And initially, when I was diagnosed, things did not look super great due to the extent of disease that I had. Surgery wasn't initially possible. But as the diagnostics continued to come back, it started to become a little bit more clear that the type of tumor I had was pretty rare. So initially, when I was diagnosed, right out the gate from the ER, we didn't have any diagnostics like a biopsy or anything, but we were pretty confident it was kidney cancer and renal cell carcinoma, just based on the fact that I had such a large tumor on my kidney and then lesions in my liver. Once we did the biopsy, it came back as a unclassified oncocytic renal neoplasm, which is a mouthful. But I was basically told it was a rare type of kidney cancer, but I didn't really know how rare it was until I dove into my own records, as well as actually even caught a webinar from the Judy Nicholson Foundation just right after I got my biopsy results back on rare kidney cancers, that really highlighted the differences between each type of kidney cancer and the different treatments that or response rate to the treatments that they can have. And so when I learned kind of more about the differences between them, I started to learn more about my own tumor and started to dive into my pathology report and recognize the rarity of what I had. So what I would end up being diagnosed with was actually an oncocytoma, but a metastatic oncocytoma. Oncocytomas are known to be benign tumors that can grow on the kidney. They pretty much never spread. Mine is the one that did not catch that memo when it decided to go to my liver, which is what made me stage 4 and then gave me a metastatic diagnosis. And so due to the rarity of that situation and the recommended treatment that I was being recommended at my initial institution, I started pursuing second opinions. And I pursued a million second opinions due to the rarity of what I had. But my husband and I ultimately would end up moving down to Texas to go to MD Anderson. I started on treatment at MD Anderson, where I was on Cabometyx, which is one of the many ways that we ended up connecting, because a lot of it, I was so nervous to start that treatment, and I'm sure we'll go into conversations about kind of the power of connections and everything there. But where I couldn't find answers in the system, sometimes you and I would talk about them, and you shared a lot of your experiences with me, which meant a lot. So I started on that treatment. I was on it for a couple months until I eventually, again, through one of your posts, through a kidney cancer awareness post on Facebook, ended up actually being connected with the National Cancer Institute through a comment that happened through that post through Driven to Cure. And then the NIH was probably the first, not probably, they were the first institution who had ever seen a case like mine. And so they were willing to take a look at it and actually offered me surgery. So in June of 2021, about 6 months into my diagnosis, we did a right nephrectomy to remove the tumor, did about 5 wedge resections, so cut out 5 sections of my liver, burned 10 tumors in that procedure through ablation. And then a few months later, we went back and burned a few more. And since then, I have been off all treatment, have no active cancer, and just on active surveillance. So that is the very long, but also cliff noted version of my story.
Well, congratulations on being an ED. And, one thing that I was thinking about whenever you were talking was just how casually you and I both, I've noticed myself doing this too, where it's like, we both are like, yeah, so I had this like insane surgery and they took out multiple body parts. And, like, that was it. That was fine. Which might just be a trauma response, honestly, right? Like, because I do the same thing. You and I were talking before we jumped on, and how, I was like, yeah, I gave a talk at the HLRCC symposium this past week and was like, yeah, I had a massive 5.5 hour surgery that, they moved my liver and removed most of my circulatory system and part of my body. But jumped on to Cabometyx and yeah, it was fine after 4 years. So,
Yeah, it's such a like crazy thing to look back in retrospect. And
yeah.
like I know you and I have talked about this as well too. I think a lot of patients do this. This is actually something that my husband and I talked about a couple times because I know once I initially started sharing my story after I got diagnosed, like I had a lot of imposter syndrome because I was
Yeah.
like, man, I don't know if I should be sharing my story because like people have had it so much worse than I have. And like I exactly what you're saying, like I discounted the fact that like this is pretty massive surgery that I
Right.
went through. And like the fact that I did have a terminal diagnosis. And I think when you get to a better place, it can feel like, I mean, I don't, never forget the trauma. I'm sure you don't either forget the trauma of what it's like to go through those experiences, but it's almost like the gratitude of where you're at kind of makes you wonder if like, oh, well, I don't want to like lessen anybody else's experience who is still in the middle of that fight right now. And so I had a lot of like imposter syndrome or insecurities about sharing for a while, but there was something my husband said to me one time when I was like sharing that experience with him, and he was like, somebody will always have it worse than you until you are on your deathbed and you are the day you are dying. Somebody will always have it worse than you. And it's really important to share the parts in between. Um, and so there's something that like really resonated with me and why I continue to share. But I think even earlier stage patients have a lot of that as well too, of like, so I know you and I have connected with many patients that are like, oh, but I wasn't stage 4, like, and there's a gratitude that I think like all of us appreciate when you like have had a cancer diagnosis that makes you realize like how fortunate we are to be living in
Yeah.
general. But um, I think that's like really important for earlier stage patients as well too. Like I don't see earlier stage patients as like any less of advocates or that they shouldn't be sharing their story. I think they absolutely should because like fear is fear. When you hear the words that you have cancer, like I think the moment everyone hears they have cancer, like there's just a fear that comes with that no matter what stage you're at.
No, absolutely. And I'm glad that you said that because for two reasons. One, whenever I hear earlier stage patients, I'm grateful that they, hopefully will never experience what you and I have gone through, right? Like, good. I'm not glad that you're getting diagnosed, but I'm glad you're getting diagnosed earlier than I was or you were, right? That's good. That means that we are moving the field forward and that we're making it possible for patients to get diagnosed earlier. So yeah, I feel the same way. And like I definitely have had some survivor's guilt, imposter syndrome, all of the above, right? Because I look at my path and it's been so easy compared to so many other people, right? I mean, even whenever I was presenting for that HLRCC symposium, I'm thinking like, gosh, I feel like I don't even have much to contribute because I had it so easy compared to other HLRCC patients that I know, right? I mean, you and I both were friends with Kelly O'Leary, who passed away last year, and I, have been close with several other HLRCC patients who went on to multiple lines of treatment, and I sit back and I go, I got randomized 1 out of 4 options, and I got onto the one that worked for me, and it worked, and it was great. Like, I had a complete response within a year. But then I sit back and I go, yeah, but I was on treatment for 4 years and that was no walk in the park, and to this day am still dealing with the side effects from that time in my life. So I guess it wasn't as easy as I've mentally told myself that it is, because I'm still here. So I get that, Katie. I can definitely relate.
Yeah, I think there's just, I don't know what it is about, like, I was thinking about this too, actually, as this is like kind of tangential, but like I went for my scans, was it last week now? Time's flying. But and I was sitting as I was watching, it's like we were all in the, like, you've gotten your IVs, right? And you're all waiting to go back to the scanner. Like, you're usually sitting in a room with other patients that have just gotten their IVs. And as we were sitting there, I was looking around the room and I saw like one woman that was like very, very anxious and nervous, like totally how I was when I like was initially diagnosed. And then I saw some other people who were a little bit more relaxed. And then, but I saw like there's this weird like camaraderie of like everybody knows what that experience is like in that
Right,
room. There was one thing that like stood out to me was there was this gentleman that walked by with the nurse who was like taking him, or probably the tech that was taking him back to the MRI machine. As they were walking across the room, like I heard him making small talk with the tech, like, how are you doing today? And like was like making a very intentional like effort to like find out how the tech was doing, and like not wanting to concentrate on his life, like literally just like cared about this tech and what was going on in their life as they were making their way to the scanner. And it like stood out so profoundly to me because like that is what I think of when I think of like people who have been diagnosed with cancer. Of like there is just this bond and such a, like an appreciation that can come for like just people and humans in general that like we end up building with each other. That I think part of that contributes to like maybe lessening our own experiences of like thinking that we haven't been through a lot, because I don't know, I think it makes you more attuned and aware to others around you and things that they might be going through as well too. But it's kind of tangential, but like I've been thinking about that moment a lot today, and like how impactful that is, I think.
I no, I agree with you, and I also think it just, you begin living a different world than, like, than you had before, whenever you're diagnosed, right? Like, I have met so many people, you included, right? That I never would have met otherwise. And certainly wish we wouldn't have crossed paths this way, right? But I'm really glad that we did. And I think about, like, because my scans are coming up in a few weeks, and I it's become so routine for me now that I definitely don't have that extreme anxiety like what you were talking about, the lady that you saw in the waiting room, right? I don't have that anymore. But it still hits me, right? Like, it still hits me. It's usually when I'm actually getting onto the bed, and like they're about to roll me into the machine, that it's like, oh my God, that's right. Like, I have no control about over what's about to happen, right? And that, I think, for me, especially now that I'm not on treatment anymore, right? That for me is the moment where I just get so much anxiety, even though it feels so old hat now, but just that, like, moment of I'm completely powerless over what's about to happen, hits me every time, and then I get my scans done at UCLA, and LA traffic is infamous around the world, I feel like. So I have a lot of time sitting in my car driving to my scans to think about, the impending what's about to happen. But on the flip side of that, like the gentleman that you were describing, I mean, I tend to get my scans now done at the same UCLA location, and I've gotten to know the techs there. I've gotten to, so it's like they always are like, hey, like how was your drive in? They know I'm coming from far, and we've started to get to know each other. And it's just it is a it is a it's a weird experience when you kind of take yourself out of it and you're like, yeah, I never would have imagined this would be my life, but here we are.
Yeah, I like live for those moments now of like just connecting with the like healthcare providers that you're I wrote about this a lot in my book. I've written a lot of these little tiny moments in because they're like moments that before I had a cancer diagnosis, like I mean, one, I was like ridiculously intimidated by doctors. Like to say that would be an understatement. Like I was so scared of them. Which is weird now that like we do so much advocacy, right?
Right. Right.
But I I was just so separated from that world because I didn't really know a lot of people that were in the healthcare profession and stuff like that. That to me, that was like a place that you get treated, and that like just my mind separated that from like reality.
Right.
But like going through my diagnosis and like having so many just very genuine human connections where you like see this person of like literally just going to work every day, just like their life and like the things that are like they might be encountering, like what they're going to go home to after work and those kinds of things that like it made such a shift in my care that like whenever I am in those places, like I love seeing the same faces over and over again because you do build those relationships and that brings like such a calmness to those scenarios. Or even like I had a I almost passed out the last time I got an IV, right? And so that hasn't happened in the longest time for me. Why that happened again last time, I don't know how, but it's quite the experience. And so then when I went to go get my IV this time, I like gave them a heads up, like, hey, got a bit lightheaded last time, like
Right.
had a bit of an incident. You guys probably should just have a heads up just in case.
Right.
And so then like me and the nurse were like just joking around the whole time about
Yeah.
like as she was like preparing things of like how to make sure that I didn't do this. And it's like, I'm gonna try my best not to. And she's like, you better not. And I was like, I I promise I don't want to either. But then like she got the IV in a second and I was like, man, you're a pro. And there's just this like when you let down the walls of like this is like a procedure and like you're just interacting with these folks is like everybody that you would interact with in your daily life. To me, I just noticed such a difference in like both the anxiety I carry through those moments, but also in the like care. I feel like both of us like enjoy those moments a lot
Yeah.
better. I'm sure they enjoy that day at their job a lot better than like if you don't take the moment to share those really like vulnerable feelings, if that makes sense.
It definitely does. And I think too, I think and I feel bold enough to speak for you on this too, because I know you and I've had these conversations. We feel such gratitude and we're just such in awe of the impact that, that these doctors and nurses and care team and all has on us. But I think too, sometimes we discount the impact we have on them. Like I remember, and maybe this nurse doesn't remember this anymore, but I distinctly remember I had a biopsy done. I think I maybe shared this with you, but so sorry if you've heard this before, but I don't think our listeners have. Um, I had a biopsy done before my surgery because whenever I was diagnosed, I mean, same as you, 12-centimeter tumor, right kidney, right, was 13 by the time that I got to surgery. But because of my age, they thought it might be lymphoma. And so they actually did a biopsy to see if it was definitely kidney cancer. Because, it looked on the scan like it was probably kidney cancer, but they just were so thrown off by my age. What's interesting now is like because I have HLRCC, they never would do a biopsy again, I don't think, right? But you don't know what you don't know. And so UCLA did a biopsy. And I remember they gave me like Twilight, which I'm sorry, that's like not a thing. Like, because they had to give me more. I was like, I feel everything that you're doing right now, right? But I remember the nurse that was prepping me for the biopsy. she and I were talking, and they'd already given me the medication, so I was kind of out of it, but not really. And she and I were talking, and she said something about how, like, yeah, she's like, wow, you're so young. Like, she was my age. She was 29, And I was like, yeah, I was like, I was really dreading turning 29 a few weeks ago, and now all I want to do is make it to my 30th birthday. And she stopped and was like, you're gonna make me cry. Like, she just was like, like, yeah, you're right. Like, I'm sitting here complaining about turning, 30 next year, right? And like, you don't know if you're gonna turn 30 or not. And at that point, I really didn't. And so, I'd like to think that we both had an impactful conversation that day, you know.
Yeah. Well, and it's wild. Like as we talk about advocacy and even like transitioning into advocacy, I know those moments for me are really what empowered me to advocate. I think kind of this entire thing is where we're talking about like, I think you and I both recognize like how fortunate we are to be in the position that we are. And that's also why I even think like earlier stage patients, like getting involved in advocacy is like an incredible way to like give back and stuff like that, right? Because part of the reason why it's not for everybody if they want to, right?
Right.
But part of the reason why I got so involved is because like I recognized what a very unique situation that I had the chance to be in. Because like I knew what it was like to have a diagnosis and be told that there's no curative options. I was on treatment and knew what that was like. And then on the other side of it, like nobody knew for sure. But there was a chance that I might have a better prognosis, right? And so I looked at all of like you and I both have lost so many friends through this that like I know we deeply cared about.
Mhm.
And there is this, for me, I know that there's this like, I know how much they wish that they could have been able to do these things, but being on treatment and all of everything that comes with that, especially as your disease progresses, there's a lot of ways you just can't physically be involved. And
Right.
so like I feel like one of the best ways that I can give back is like while I do feel well, that's when I'm going to advocate for the people who don't, because like let's keep moving this ball forward. They need somebody advocating for them. And earlier stage patients are in a really good place to do that as well too. And that's why I feel like I always want to make sure that like earlier stage patients don't feel like they're like have a lesser disease or what they went through was lesser or anything like that. Because I know those thoughts can come in for some earlier stage patients because you're not on treatment. But I see that in a lot of similar ways to like what I've been through being stage 4, right? Because I'm in a very similar position, not on treatment. So like there's a part of that that I think once you've gone through something like cancer, it does change your perspective in life. And I know for me, I didn't really know what to do or how to point that. I knew I wanted to give back. I knew I wanted to do something, but I didn't know how. But there were so many interactions that I had after I got diagnosed that just like sat with me. And there are a lot of those interactions that you talked about of like somebody that took like 30 seconds out of their day to just like have a very human moment of like something a lot of times that like that people might not have thought was like the most professional or something like that. Like professional is not really the right word. I don't even like calling that because I find that like those very vulnerable moments, there's nothing better, I feel like as a patient than connecting in those moments. And so like but there are moments people stepped away from the job and connected on a human level, like sharing something like you just shared of like something that brought a new perspective to them or um like just trying to think of very specific examples. Some of them like weren't even some of them were doctors and providers, but other ones were like my phlebotomist. As like I was at the NCI again was having an episode where I almost passed out. They were collecting like 20 tubes of blood. So it was a lot during that period of
You have
time.
like a
But
walrus bracelet, right? I just want to make sure.
I do. I do
Okay,
actually.
good.
Unfortunately, I have earned the yellow band.
It sounds like you have.
um, I normally don't. Both of these stories are about almost passing out, but it's not that common of an occurrence for me. But for example, that phlebotomist, like when I was having that experience, like he kicked in, his training kicked in to like ease my symptoms and whatnot, right? But then like I could tell like he was like empathetically also like reacting to me. Like I could tell like seeing me upset was like affecting him. And so like I share a little bit about that experience in my book as well. But afterwards, I went back down to that lab a couple times, and he ended up sharing with me that like I reminded him a lot of his daughter, and so like it was that moment that I was like, that's why that connection felt that way. And so like there are all those little things that like you recognize that like I don't know, we're just all connected on this like very human level. And like the best thing that we can do is to be able to like, for me, was to be able to like dive in and be able to like try to start advocating. And like it made, I don't think I ever would have had the confidence to get involved in advocacy had I not had those moments because I would have been too intimidated to have ever stepped into the space. But recognizing that like we all just are going through this shared human existence together, like opened up those doors.
Oh, I wow. I couldn't have said it any better, Katie. And I think that's I mean, you touched on really why I do what I do too, right? I know you and I've talked about this before, but um, I do it one to honor the patients that, our friends. I mean, they weren't just patients, they were our friends, right, that have passed that every one of them was always supportive of the advocacy work that, you and I do. And I also just think it brings a human perspective to the work that researchers and doctors, nurses, the whole team is doing. I know I'd shared with you after our friend Kelly died. It was the week that I was I'm trying to tell the story without crying. I had to go to SWOG, the clinical trial network that I work with. And so I was looking forward to having dinner with her, and then she passed that weekend. And I gave kind of an opening speech for our genitourinary committee meeting about how, you know, we're patients. We're not just dots in a chart. We're not just, people, we're not just little specks of information. And I think that's why it's important that we do what we do. And selfishly, for me, I want what I've been through to have some meaning and purpose. And that's not for everybody, and that's okay, right? I know some people need to just go through it and move on with their lives. But for me, I was like, I didn't go through all that to just have it be for nothing or have it be meaningless. And so that's why I do the advocacy work that I do, because I just think that I have to give some purpose to the pain, and to the experience. And like you, I mean, I will never forget seeing in my chart, in bold letters, patient understands this is terminal and any treatment is palliative only. And I remember thinking, no, patient does not understand that. No, no patient does not understand that, right? I think once something like that happens, it's a turning point in your life, right? I mean, there's no going back to the person that you were before, at least not from my perspective.
Yeah. And it like, it's wild for us too to be talking about that, right?
Yeah.
Because like you were my beacon of hope when I had that exact thing explained to me. Um, and I think that's what's kind of wild about all of this is when you're talking about like finding purpose through the pain, like the I think about that all the time of like it's the desire of like wanting the worst thing that has ever happened to you and wanting something good to have been able to come out of that. And I remember sitting in my very first appointment with my oncologist, which isn't the oncologist that I have now, but I sat in that appointment and I remember hearing that the drug I was on, that I was going to be put on, Cabo, doesn't cure people. And so, like, my treatment goals weren't curative. And I understand why they were saying those things to me, especially like given the extent of disease I had. Cabo would have been very unlikely, if not impossible, to take care of that level of disease. Like I just had a very large tumor burden. Um, but I remember like you go through so much in those early days, and there's just like so much emotional like trauma that you're trying to process while you're also trying to make these decisions and trying to like figure out and navigate care that in that moment, I remember like you instantly popped in my mind. And like I agreed to start the treatment, and I was starting the treatment because I was like, nope, it just happened to one person. I was like, I know somebody who is on this. And so, like, and what's wild is like being an advocate. We were actually even talking a little bit before this call about this, the connectedness of this community of like sometimes, especially if you have a rare cancer, you end up connecting with people and know things that sometimes like your providers that you might be sitting across from have never heard of or been connected with because like these relationships are so interconnected. Um, and so for me, when I like started on treatment, I didn't need to know that that was going to happen to me. Like it was just the fact that it happened to somebody that gave this like glimmer of hope and allowed me to like continue my day to day. Right. And then like I connected with you and like when, for example, like when I couldn't find answers about how this medication might affect me as a young woman because that hadn't really ever been prescribed to young women in the trials for them to really know. I mean, they had, but those results hadn't completely resulted by the
Oh
time
yeah,
it was
that
going,
hadn't been
right?
published yet. Yeah, yeah.
Yeah. And so, but I could talk to you directly. And there was a few other patients that were on young women that were on Cabo that I was able to connect to directly and hear about their experiences. And there's very few things that are more powerful than that. And I know that like exactly what you're talking about, the like we're more than just a dot on a graph. Like I don't know if you're this way, but every time we go to these big conventions, like I think about that when I see these results explained at trials or at these conferences. Is like I'm thinking of the patients I know that like are on those medications and the conversations I've heard them have about the very side effects that are being presented.
Yeah.
And it just brings a very unique perspective that I personally feel like I know you and I sometimes can discount what we were talking about, like our own experiences or trying to figure out how you fit into the space. Um, but I think that's a perspective that nobody other than patients who have gone through those things themselves can really bring to the table in some of those conversations as well too.
No, absolutely. And going back to our earlier conversation about early stage patients, right? I mean, I think that's why it's important, no, you may not have had the experience that I've had or that Katie's had, but it is the worst thing that's happened to you, right? And you
Yep.
still have something to contribute to the conversation. And I've shared before, I mean, the two patients I connected with early on, and literally the first two kidney cancer patients I'd ever talked to were two patients who were in their 30s, and they were stage 3 patients. They weren't stage 4. They'd had a nephrectomy and, more or less had gone on with their lives, right? But even though I was more advanced than they were, honestly, the conversations I had with them gave me the courage to go through with surgery. It really did. And so I always say that like you don't have to have the same exact experience as someone in order to be helpful and contribute to the conversation because they didn't know anything about treatments. I mean, honestly, there were the treatment landscape looked so different in 2016 than it does now, right? And they had been both diagnosed, a few years ahead of me, so even more so. But just knowing that they'd gotten through surgery, that they were, had gone back to whatever a normal life is post cancer, right? Gave me the confidence to feel like, okay, I can do this. I can get through. Because up until that point, I'd only had like what my tonsils and adenoids taken out. Like I'd had no significant medical history other than like, a childhood surgery that most people have, right? I mean, so I mean, I think about that and like I really was terrified to go through with surgery and I mean, I'm sure I would have done it, but I definitely felt more confident and more secure in my decision because of those two patients who again weren't stage 4 patients.
Yeah, exactly. And I personally feel like that's like one of the biggest ways. I know there's lots of like Facebook groups and even Smart Patients, so a bunch of groups online to connect. But that is one of the biggest ones I see for like earlier stage patients is like everybody who has kidney cancer that's diagnosed at an earlier stage. Not everybody, but and especially now it's changing as like more multidisciplinary treatments come in. But like the number one fear I see is exactly the same fear we had, right? Of like, I'm terrified for this surgery. And like you and I might have had more complex surgeries, but I think so many patients like you're losing a literal organ or they're like
Right.
cutting your organ. Like if you get a partial, they're taking part of it, right? And so there everybody can bring something to like that the bond that creates, right? Like it's you just want to you can hear a million times from your doctor you're going to be fine. It is completely different when you hear from a patient that was like, oh yeah, don't worry, I was completely petrified too, but like I'm
Right.
good now. You're
Right.
gonna get through this.
Yeah.
Like there's this like validation that like is so important and like such a big way that like any patient can like bond with other patients and like help. You literally are helping other patients that way. And I've thought about that a lot is like we've gotten more and more involved in advocacy and in these conversations of like hearing the perspective that comes from institutions and like um, the it's weird like once you've been a patient and you've sat through those conversations and then hearing how those conversations are like how they evolve from the other end. Um, you can see why the answers are given the way that they are. And a lot of that's because so much context, right? They learn so much about like, especially like say stage 1A, for example. So you've got very small renal masses. Um, Usually if a surgeon cuts that out, they're going to think like, oh, this is great news. Like you're good to go. Like, and there's a very like positive um, feeling around that. And I think that oftentimes is communicated back to patients. Whereas as a patient, you've just been told you have cancer.
Right.
And so like there's an entirely different experience with that, even if your odds are like very, very, very good, like near 100%, for example, if you have an under a 3 centimeter mass with most types of kidney cancer, not to come back. Um, the and that's a little more nuanced. So maybe, um, see, even I, like, now that we've gotten involved in this space,
I know. I know.
like all of the, like, yeah, it's so nuanced. So you understand how those conversations
Yeah.
end up evolving. But when you talk to another patient that was diagnosed at that same stage, right? And you both can relate to the fact that, like, yes, I'm scared to go under anesthesia, or like, I'm scared that, like, I know chances are low that something will go wrong. But when you've been that patient, that especially like patients that are diagnosed young, for example, like you already know that something statistically unlikely happened with you getting cancer so young. And so there's just such a different feeling and connection when you can connect with other patients on that level until you build up your own courage that comes from like trusting your body again. As you notice, you get through it and get through the scans under you and everything like that as well too.
Yeah. I don't know that I will ever trust my body again, honestly. But I have a lot more confidence than I used to, right? And I've shared with you before like the times where I've had scares, whether they were me spiraling like or legitimate like okay, maybe this is something that I need to be worried about, right? I just think like one, I mean, the field has advanced so much since I was diagnosed, right? I mean, there are so many more options than I had whenever I was diagnosed. And two, I know that I responded really well to TKI before, and I know that's a viable option. And three, like, I mean, I go to the same conferences as my doctor now. And I know you share this experience too with your oncologist, right? And so I know him really well and I trust him, and I trust that like if God forbid I get bad news, after a scan, that like I trust that he's going to have a plan, and that, it's going to be the best plan, and may not cure me, but, will at least give me the best shot, which is really all that we can ask for, honestly, right? Is like, but I didn't have that same confidence 8 years ago, not because I didn't trust my doctors, but just because I didn't know what the heck any of this was, right? I mean, it's kind of mind blowing now. Sometimes I still sit back and go, wow, I can't believe that I actually understand what they're talking about at these conferences that we go to, because I spent so much of my life avoiding math and science. And now I still couldn't probably do anything physics related, but I do understand biology really well now. Um, and cancer treatment specifically. So it is a wild, it is wild looking back and realizing that, I think that's where a lot of my anxiety has faded over time, because I just feel very confident in where we're at right now.
Yeah, and I think you and I have talked about that a lot about how in the beginning, right, you don't know much. And so
Yeah.
like you're forced to make the most important decisions about your care at a time when you know the least about your disease.
Yeah.
And so like I think it's totally normal to like feel overwhelmed and to feel scared during those periods of time. And I think the one thing that I was laughing a little bit as you were sharing about is because like I think it's also really important to point out that like even though it changes, because I definitely think it changes, and I think knowledge is power, and I think it helps, like when you understand the context of your situation a little bit better, but also the fact that like you and I have texted each other, even recently, of
Yes.
like when we've had something come up
Right.
and we've had to notify our team about it, and both of us have this like connection that we end up having of like, but yeah, cool, cool. I wasn't worried either, right?
It's true.
But there are these like we have complete confidence in the where we're at, but we like even then have these like interactions with each
Yeah.
other where there's still this like bond that you're always going to have with another patient of like
Right.
those scares sometimes just come up and they're just like
Right.
they're a part of living after you've had cancer.
Yeah.
And I think it's totally normal to like recognize one that they happen and then honestly to like laugh through the circumstances, especially if you're like connecting with another patient
Yeah.
over them.
Yeah, I think you're one of the people in my life that I can text at 11 p.m. and say, hey, so I think I maybe have a secondary cancer, and I've already figured out what the treatment's going to be if I do. I don't have, thank God, I don't, by the way, but like, and you're not going to be like, Laura, you need to just be committed to a psych ward. Like, what is wrong with you? Like, you're like, okay, yeah, sounds like a good treatment plan if you need it. So, um, yeah, it is a different perspective. So pivoting a little bit, because I know we've kind of danced around in this conversation. You and I both have become patient advocates over the years, and go to all of these like ASCO, which I just thankfully just saw you in Chicago a few weeks ago at ASCO. And for those that aren't aware, ASCO is kind of like the big game of oncology. It's where I think they said there was over 35,000 people from around the world there this year, and like another 7,000 online, which is just crazy. Um so it's a huge annual meeting to discuss a lot of like the big kind of clinical trial breakthroughs and all usually are discussed at this particular conference. And for me, I one love going because I get to connect with, people like you and, other patient advocates I'm friends with. And then I get to see a lot of the doctors and researchers that I'm close with and, connect with them as well. So it's always really amazing to be able to go and see these things. But I know not every patient gets that opportunity. And so I think this year was kind of for ASCO was kind of like the lung year. Like I know there was a lot of big lung cancer trials that came out that had some super exciting impacts on patients. But I just was curious, was there anything at ASCO that you heard or saw that you were really excited about for kidney, or maybe even just a fun experience that you had while you were there.
Yeah, there was actually quite a few of them this time.
Yeah,
So last year was my first time going to ASCO.
mine too.
And I know that like I didn't really know a whole lot of people yet, right? Like, 'cause I was just getting involved in the advocacy space. And so this time it was really neat, like going back and actually knowing people and having those relationships to carry on some of those conversations. But some of the things that really stood out to me about ASCO this year is chromophobe kidney cancer actually had an oral abstract that was presented for the first time. So that means they basically had some research, some early research that they're doing, being able to be presented on stage at ASCO, which is a pretty big deal for such a rare type of kidney cancer. And so they presented some data that they've been collecting across institutions on chromophobe kidney cancer and comparing response rates to medications. And so it was really cool to see that up there, especially because when I was initially diagnosed, there was a period of time that they thought I might have had chromophobe kidney cancer. I eventually ended up starting a nonprofit COA for chromophobe kidney cancer. And all of that happened because just a few patients with chromophobe kidney cancer started rallying around the efforts. It initially started with one grant and us all rallying around bringing that grant to life. And that eventually led into a couple grants, led into me creating this separate nonprofit and chromophobe kidney cancer. Like we are just about to announce the award in the next few months of the fifth grant to be for chromophobe kidney cancer since in the last 3.5 years since like I was diagnosed, right? And so to see chromophobe have an oral abstract was like super impactful for me because I was like so proud of the chromophobe community because those aren't my efforts. Those aren't just this other small group that started advocating. That's because like chromophobe patients started speaking up and advocating, and it really showed the power of like what happens when you get a small group of people together to organize and start moving forward towards change. So that was very impactful. I also thought the Kim1 data, so for biomarkers for kidney cancer. A lot of the other cancers have biomarkers. I remember joining ASCO GU this year, and I went and sat in on some of the prostate talks, and I was like blown away because I was like, prostate is such an entirely different world than kidney
Entirely
cancer
different.
because they
Yeah.
have all of these biomarkers. They know how to treat the disease based on different tests that they can run. And that doesn't really exist in kidney cancer yet to be able to completely be able to figure out who's going to respond best to what. And biomarkers are a big push, I think, currently in kidney cancer. And so there was some data presented that might look like a biomarker that might possibly be starting to emerge in that area. So I was very interested in that one as well too. And then the rare kidney cancer session. I actually really liked that one. There weren't a ton of us in the room. One, I thought there was an incredible talk about palliative care that
Yeah.
was absolutely incredible that we got to listen to a part of that one and talking about the importance of including palliative care early on.
Yeah.
It's not just when you've run out of options and it's different than hospice, but also it was pretty impactful as I thought back on that session and realized like there was at least three, if not more, of us who had rare cancers in that room, in a
Yeah.
pretty small room of folks that were there for that presentation. Um, and that was just like very impactful to recognize that. And you even stood up at the mic, which I appreciated. It was just one of those moments of like recognizing the importance
Yeah.
um, that and the impact that patients can drive, especially rare cancer patients when they really like rally around an effort.
Yeah. I
So those were
agree.
really my top moments.
I like that. Yeah. That session for me was, again, very humbling because every time, so Dr. Monty Powell at Sleep Hope was one of the presenters, and he's the one that led the trial that I was on, as you know. And every time he presents that slide, like one, it's so humbling because again, I can see myself. I see myself in that like it's like two complete responders and the line keeps going, right? And I'm like,
Going.
oh my God, that's me, right? So it's always very humbling. But also just to hear how like, I mean, it's old news, and that's good. I'm glad that it's old news, right?
Mhm.
That like we're talking about so much more now at ASCO, which I think is incredible. And I had Dr. Ben Mon on the podcast last month, who I know Dr. Mon well too. And, that's one of the things that he was saying was just how it's great that we have moved now to the point where it's like we're not talking anymore about, I'm saying we, but like, I mean, it is we now too, right? You and I are involved in these conversations. We're not talking anymore like they were 10, 15 years ago, where it was like, is it even worth it to break off and do non-clear cell trials? Which was the conversation that was happening, right? Where they were like, do we really need to do trials that are focused on non-clear cell kidney cancers, or can we just continue doing clear cell trials and kind of transpose that data towards non-clear cell? No, now that question's been answered and they are having these conversations about what types of trials are the best ones to do for rare kidney cancer patients like us. And again, just circling back to, that's why I think it's so important that we're in the room, right? Like physically or figuratively in the room, because, you know, um, these, I mean, I've sat there and listened to trial design discussions, and the trials will not happen unless they believe that there are patients who want this. And so if
Yeah.
we're not visible, if we're not active, then it leads them to believe that it's not something that the community wants. And that's why, again, I think it's just so important that we are in these spaces. But yeah, I was also really excited about the Kim one as well, because I do happen to sit into a lot of prostate conversations because we get lumped into genitourinary, and so especially when we go to SWOG meetings, it's like prostate, 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 kidney, right? That's not to
Yep.
say that they don't care about kidney. They do, they really do. But it's just prostate is so much further along, right? To your point,
Yeah.
that kidney
Mhm.
is. Um, and so it is really interesting to like hear the conversation, like to hear the trial concepts and all that they discuss, which are, I'm like, man, I can't wait till we get to the point where we're at that, like where we're having those discussions in kidney, right? Because it means that
Mhm.
we understand the biology so much better, and that we understand the mechanics of the disease better. Disease is really, we really should say cancers, because it's an umbrella. It's not just one type of kidney cancer. So
Yeah. I know when I've listened to prostate conversations, like hearing the fact that they'll talk about like a very specific biological marker or
yeah,
something that they found, and they'll have conversations of like, why in the world would you recommend that to this patient with XYZ, right? We
right.
don't have that. And
Yeah,
so it is that exact like, I am excited for when we do have that, because we see it all the time, like translating it back to what we see as patients and in the community is you see patients asking all the time, like, well, how come some patients respond to immunotherapy and other patients don't? Or like trying to evaluate. I mean, now that, like, for example, that treatment for intermediate and high risk for clear cell kidney cancer is moved into an adjuvant setting.
yeah,
For patients that might not know what adjuvant was, I didn't know before I got involved, is that's treatment after you've had surgery, for example, and before the disease comes back. They call that adjuvant treatment. And like even evaluating that situation, right? Of like, what's the benefit risk ratio there that patients are willing to undertake of treatment can cause side effects, and immunotherapy can cause some lifelong side effects. And so trying to evaluate the risk on making sure that while that risk is still low, you want to make sure that you're not giving those side effects to somebody who ultimately would never have the cancer come back. And so as we move more towards these biomarkers, it'll help answer those questions of who are the people who it is most likely to come back in, and making sure that you're only just giving treatment to those people instead of like blanket giving treatment across the board. And I mean, I don't think people blink, not people, doctors aren't blanketing treatment across the board, especially in like the adjuvant setting right now as well. It's a conversation to be had with your providers, but right now there aren't those markers to help them make those decisions off of, really.
Yeah. Well, and I think what's important too for our listeners who don't spend all their free time at cancer conferences like me and Katie do to understand. Because I mean,
Very
because
fun.
in all fairness, I didn't understand this until I got more active in the space, right? Is that the reason why that we don't have biomarkers identified yet, other than potentially KIM1, which sounds like that may be the first biomarker for kidney cancers, is because it is a different disease than like breast cancer or prostate cancer that that they have biomarkers, right? Or even now we're learning colon cancer now has a ton of biomarkers that we weren't aware of until literally just within the last couple of years. So it's I think that especially if you're newly diagnosed with any type of cancer, or I know definitely there's people in my life still that think, oh, cancer is cancer. No, it's not. Like I mean, it behaves differently even from patient to patient, which kind of going back to your point, Katie, is like I have a lot of, especially HLRCC patients who ask me, okay, well, so I just need to do cabozantinib and then I'll be good, right? I'm like, no, that worked for me, right? In my body,
Mhm.
in my particular type of disease, but like it doesn't mean that it works for everybody, right? And I think that again, we're getting there. That's what gets me so excited after I come home from like conferences like ASCO, or if I go to my SWOG meetings, and um I always get a little overwhelmed at like, wow, like this was some really heavy stuff that we just discussed, but I just feel so hopeful every single time, and my hope grows every single time, and of course I hope that I personally never have to go back on any kind of treatment, as I know you do too, but like it makes me so hopeful that we're finding answers that a patient that's diagnosed even this year will have such a different experience than me or you did when we were diagnosed. Um,
Yeah, 100%. I think the thing that I really took away from a lot of these conferences as well too is so that the data that came out of the KIM1 that presented the biomarker, that was a trial that did not, like the treatment that they gave didn't show
yeah,
statistical benefit or significance that it would benefit patients. But because they collected all of the data and they collected samples on these patients, they were able to help figure out who was responding and who wasn't. And so I know you and I talk about the importance of like being involved in trials a lot as well too, and evaluating trials. I think that's the one thing that like makes me the most excited about the things that I'm hearing is that they've identified the importance of like collecting samples and doing those things in these trials, that there are real ways that patients can participate. One, in these trials, like sometimes you can be participating in a trial that might even be the same drug that you would have gotten out of the trial.
right.
But like they're learning so much more because they are collecting these biomarkers and all of these different things. And so you were talking about the reasons that some of these other cancers are a lot further along. We both have seen how long it takes to accrue in a trial to like get enough patients to even complete your study to know the answers to these
Right.
questions. So that's one area I think patients have the ability to really kind of supercharge, honestly, is you always want to evaluate if a trial is like beneficial for your specific situation, but patients have the power to be able to participate in these trials and really accelerate that by like helping to fill the trials. If it's something that they think will be beneficial to their care, they're not only like have access to other treatments in a lot of scenarios, but they are contributing what we were talking about earlier in the like sometimes you just want the worst thing that ever happened to you have something good that came out of it. That is what like collecting all those samples and everything like always stands out to me as a patient in my mind of is like you might have an extra blood draw or something like that, right? But they might find something in that that actually could be something that helps other patients down the line, whether this treatment helps you or not. And hopefully the treatment does help you, right? Like that's why um, like a lot of patients join a lot of these trials is for hope for that. But it's just very exciting space to be in right now, working at the Rare Cancer Research Foundation myself as well with like pattern.org that like allows patients to be able to donate their samples. Like it falls into a lot of that same stuff. And so I think it's really exciting to watch the progress that I think is coming along. And I'm hopeful for patients. Like I think we're getting closer and closer and closer to like treating this disease and like I mean, we see it on all the graphs, right? Like when you first got diagnosed, the stats were lower than when I found them. When I found the stats in the ER when I was diagnosed, I found 8%. And those rates have risen, right? And so I think that it's just so impactful to go to these conferences and to watch that happen. Because as a patient, when you are waiting to decide or you're waiting to find out if a treatment is working for you, that time feels like an eternity. And it feels like
Yes.
things could never be moving fast enough. Because like you need the cure, like you're always looking for the like, I need this to be a complete response, or I need to get to this next thing. Like I need it to work. It feels like time is not moving fast enough.
Yeah.
But sometimes it's even just like sometimes you're kicking that can down the road for as long as you can because there are more developments and things that are coming. And I think that's the thing that brings me the most hope as a patient.
I I couldn't agree more. And I once I accepted that the goal was to keep me alive long enough for better, more precise treatments to come out, it helped me get through, quite frankly, the worst days of being on treatment, right? And thankfully, I had the Hail Mary response, right? I had the complete response, but um, I do think that it's something that, is important for patients to realize is that, we are getting to the point where you don't have to yes, you may have to go through this, difficult treatment. You may have to experience some gnarly side effects, right? But that hope is coming, change is coming. And yeah, I laugh sometimes at myself when I think about how naive I was. Like I whenever I joined the clinical trial that I was on, S1500, I would like go to clinicaltrials.gov probably like once every 2 or 3 months to see if there were any updates posted. And I was one of the earlier trial registrants, right? Like I mean the trial opened in April, like about a month before I was diagnosed. I think it was April. I have to look back now. Maybe it was September. Anyway, no, it was already open whenever I joined in September. But point being was I was an early registrant. It all blurs together at some point. I was an early registrant and I don't know, I was like, yeah, surely they are going to be posting some kind of like preliminary results. I had no idea. I had no idea how long it would take, right? I mean, I joined the trial in 2016. The trial results weren't released until 2021.
Yep,
And
April
yeah,
2021, right? Because I remember that was while I was in those discussions
yeah,
about Cabo for
yeah.
non-clear cell.
I remember I got an email that it had been posted, and I was sitting at work and I just like burst into tears at my desk. Like I just was like, it just was so, um, it was so impactful for me, because I was like, oh my God, like this is, this is what you hope for, right? Whenever you join a trial. And then like I just was crying because the trial results were released, and then to read the summaries where they're like one of two patients had a complete response, and I'm like, that's me. Like I'm that I'm one of those two. Or like, it was like, here's the age group that was, joined and it said 29. And I was like, that's me. Like I'm the youngest patient, right? So it's a very humbling experience. But then I also look at like, I mean, now I know Dr. Powell really well, right? My former oncologist who's since passed, Dr. Vogelzang, was part of the SWOG committee that, greenlit the trial and helped create the trial. And Dr. Brian Shook, who's my oncologist now, he was one of the main people in the trial as well. So, he was working with my samples before he even knew it was me, right? But yeah, it's a full circle experience. And again, I think, for patients that go, well, how do I contribute to the space, or what do I get out of this space? You know, to me, again, it goes back to like there's purpose in what you're going through. Your story can change people's perspective and their outcomes, quite frankly, right? I mean, you know, um, I think about the patients that I've helped connect to NIH or to other places that, I'm not trying to pat myself on the back, but that, it does change your course sometimes. So, now that we're both like near tears, maybe you can share with me what you're what you've been up to in your abundant spare time, Katie, because I know you, to your point, you have Kidney COA, which is the Chromophobic Oncocytic Tumor Alliance. You also work for the Rare Cancer Research Foundation, and I hear that you're like working on a book, or that you have a book that's coming out.
I might have. I was thinking about that recently because like talking about all this uncertainty that we talk about, right? When
Yeah.
you go through a diagnosis like this. So by the time my book will have come out, so my book is called Too Young for Cancer, talking about being the youngest patient diagnosed in a lot of these situations. Took me a year and a half to get diagnosed. I know it took you a while, or you were experiencing symptoms as well too before you got diagnosed. I share what it was like to be diagnosed at a really young age, but also like all of these moments that we were talking about of like navigating the healthcare system with like a really rare diagnosis, and what it was like to go through treatment, and even like the connections that you were just talking about of like how can patients get involved, and talking about sharing your story. You're being quite humble there, of the impact that you have had on other patients. So there is something that I share in my book that, ooh, I'm going to get teary-eyed talking about this as
I'm
well
like, I
too.
can't look at you, Katie,
Um,
or make you cry.
but so one of the things that I think about, when I knew I wanted to get involved in advocacy, but I didn't really know how or anything like that. I think a lot of the things that um, patients should never underestimate the power of like sharing their story or being vulnerable, and sharing their experiences, no matter what they've been through with other people, because sometimes you don't know that it's simply sharing your story is the literal connection, that can connect another patient to something else. So during Kidney Cancer Awareness Month in 2021, I didn't have a lot of options. I was on Cabo, but it was not meant to be curative for me. And we weren't even sure if I was going to respond at that point. And Laura had never seen a picture of what her tumor looked like. But I had just posted an image of what mine looked like, which like took up the entire like right side of my body, because it was a 12 centimeter tumor. And if nobody has seen Laura and I, we're both like 5'1" ish. And
We're
like people
slightly
confuse us.
short in stature.
Yeah. We people confuse us at conferences all the time. We're both
Yeah.
diagnosed at 29, right? And so like we had so many similarities, that I know you posted about the similarities of our story in that kidney cancer awareness post. And it was the first time you had ever seen kind of something that represented what like your tumor probably looked like inside of you as well.
Yeah.
And all Laura did, was post that, was to post kind of the interactions of the feelings that she felt when she saw that image when I posted it. And then she shared a little bit about my story as well, too, to bring awareness for kidney cancer. And she ended up saying in that post of, I wish I had the direct words in front of me here, but it was along the lines of like Katie is starting on Cabo just like me. And you know what I believe in the depth of my heart is that Katie will be standing here 5 years from now, sharing her story, giving hope to other patients, which is going to make both of us cry because
I
that
did
was
not
during a
prepare
period of
for this
time.
adequately. Did not bring Kleenex.
Not a single person would have said that. about my case at that period of time. But you represented hope for me. And your response on that trial represented hope for me. Before I even knew that you were the result in the trial, I had seen very, very, very preliminary results from your trial
Yeah.
that helped me like realize that, I mean, you can't apply these one-to-one across the disease, going back to the like things we were much more naive about early in our diagnosis. Um, but I just needed hope and I needed something to buy me time.
Yeah.
Starting on Cabo, hearing your story, that bought me time. Um, I actually responded to Cabo, which was helpful because it pulled the tumors away from like some pretty vital structures that would have prevented me from having surgery. But Laura sharing that post during Kidney Cancer Awareness Month, beneath that is where Bruce, who was running Driven to Cure at the time, commented. And the only thing he said was like, go Cabo, go. He was cheering me on for my treatment. And then he posted a link to Driven to Cure, which had a picture of a young man in front of a GTR. I had worked in motorsports for 15 years at the time, which is the only reason why I clicked on that post. And that connection is what drove me to the NCI. And just like Laura sharing um, my story through that post, like now years later, I have had some very similar interactions from sharing my story and having a similar impact on other patients. And so there is just such a indescribable way that we are all connected here. And so I'm really glad that you shared the importance of patient sharing their story, because one of the best ways to get involved in advocacy, I think, is patient sharing your story. And you might not know the impact that that can carry, but it really can. I share, so you're talking about all the things that I'm doing. So I share all of that in the book, and share some of our interactions in the book as well too. So if anybody wants to help out, I am donating all proceeds from that book back to research. I donated my book deal as well. So I recognize how fortunate I am to still be here and just want to be able to help other patients, hopefully be in the same shoes one day. And we get there through research. So my book is currently available for pre-order. Pre-orders definitely help the book. I knew nothing about publishing before I started writing a book, and have learned quite a bit along the way. And one of the biggest things that I've learned is that all the pre-sales that happen before a book is released count for the first week of sales, which is what helps people get visibility of the book. So any pre-orders definitely help out. katiekickscancer.com/memoir. Is where you can find all the places that you can pre-order, but it's available on Amazon, Barnes and Noble, Target, pretty much anywhere you can go buy a book. You can find it there. But it officially comes out in November. So it's just a little sharing about that as well too.
I'm glad you did. I am going to be dropping in the show notes a link to how you can pre-order Katie's book. And I had to giggle to myself a little bit whenever you said about how you've learned about book publishing. You know, you didn't know anything about it before. And I'm thinking like, well, you and I both didn't know anything about cancer until we were diagnosed. And here we are like discussing Chem1 and biomarkers and everything, right? So no, Katie, I really appreciate you sharing that. And you know, you and I have talked before about that particular interaction, how, you know, one, it was very emotional for me to see your scan because to your point, I'd never seen images of my, you know, my scans pre-cancer or pre-surgery, I should say, not pre-cancer, pre-surgery. Um, and it was emotional for me to see like, wow, it really was taking over my abdomen, right? Just like you. Um, and you know, I think to your point about hope, right? I mean, you know, I know how important it was for me to hear people reinforce that I had a reason to be hopeful. Whenever pretty much everyone was saying that I shouldn't, right? And I always say somebody has to be the statistical outlier. This is the truth,
Yeah.
right? Somebody has to be the statistical outlier. So um I'm very glad that our paths crossed very terrible way. And, I'm very, very humbled to have had a small part in your story. So thank you.
Thank you. I've got to stop talking before I
I
turn
know, I know.
purple.
I was like, here I am, like my makeup running down my face. So, I don't think I don't know if I could finish it with anything better than that, Katie, honestly. Any final thoughts or words of wisdom for our audience?
I think the only thing that I would say is just like if you have a desire, which if you're watching this, you might have desire to learn more or get involved in advocacy, that I encourage patients to get involved in any way that they can, whether that's sharing their story. We go to the conferences and it's not realistic for everybody, right? Like you and I last year when we went, like we shared costs for that because it is pretty expensive
Yeah,
to go to these things. And I don't think every patient needs to be involved on that level. You can really get involved in any way that like fits into your life. Maybe it's just sharing your story on a podcast or in a blog article or doing one of the fundraising events for one of the many nonprofits that exist in the space, like Judy Nicholson, including. And so I think just encouraging patients to get involved if they want to, and if they're not sure how to get involved, to reach out to other advocates who are involved in the space. I know I've plugged in many patients with different organizations to get involved. So, and I know you have as well too. So I think that would probably be my biggest parting piece of advice is to no matter what stage any patient is ever diagnosed with, never doubt the impact that they can have if they actually do want to get involved and to reach out to folks if they want to.
that's a wrap, y'all. I don't think I can top that. So, Katie, as always, such a pleasure talking with you. And I'm just so incredibly proud and of all the work that you are doing and continue to do. You make a huge impact in our community, and we're lucky to have you. So thank you. And again, this has been another episode of Real Talk on Renal Cancer, sponsored by the Judy Nicholson Kidney Cancer Foundation. I'm your host, Laura Esfeller, and again, this podcast would not be possible without the support of Exelixis, Merck, and Ipsen. And I will see you all next month. Thank you so much, Katie.
Thanks for having me.
Thank you.